Good afternoon, everyone. Thank you for joining our webinar today. My name is Suzanne Walker. I am the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. For those less familiar with Jones & Bartlett Learning, we are a provider of instructional assessment and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. Before we get started today, I just wanted to review a few housekeeping items. This presentation will last about 20 to 30 minutes, and following that, you'll have the chance to ask questions. Since we've got a number of people registered for this session, we've muted all your lines. Therefore, we won't be taking questions out loud, but rather encourage you to type your questions in the question box located in on one of the panels on the right side of your screen. If you think of a question at any time during the presentation, just type it in the question box and we'll answer those questions at the end of the session. Also, the entire webinar is being recorded today, so shortly after today's webinar, I will provide you with a link to the webinar recording in the event you want to review anything or share it with a colleague. Before we launch into the demo, I just want to give you a quick overview of this engaging new product. Navigate 2 Scenarios are a virtual learning tool for students that exposes students to a variety of day-in-the-life career experiences. Through immersive learning simulations, students develop the critical thinking, problem-solving, and communication skills necessary to apply their knowledge to situations they will encounter in their future professions as a healthcare professional. Each episode will walk students through a virtual world where they will apply their classroom knowledge to make real-life decisions as a healthcare administrator or other healthcare professional, and interact with colleagues and patients to practice learned skills in a safe environment. With that, I'd like to turn things over to Danielle Bissett, our presenter today, who is our product manager for health administration. Danielle is going to demo for you today the Navigate 2 scenario for healthcare delivery. So I am turning over to Danielle.
Okay, thanks Suzanne for the introduction. To reiterate, I'm Danielle Bissett, Product Manager of our Health Administration titles here at Jones & Bartlett, and I'm very excited to be demoing this product for you. We'll be walking through episode 1 from the healthcare delivery scenario today. It's called The New System, so let's jump in. So for the introduction, Bright Road Healthcare has an outdated health record system. The board of directors of Bright Road is considering 2 new electronic health record systems that could be implemented in all of its facilities. As a healthcare IT consultant, you will work with team members at the corporate level to gather information and analyze the efficacy, safety, security, legal factors, cost effectiveness, and cost benefit factors of each system. Based on this information, you will recommend which system Bright Road should implement. Your recommendation should also include a high-level implementation plan that considers system cutover and change management. Continue. You are sitting in the office of your team lead and mentor, Tanya. Apparently she's late.
Thanks for meeting with me. I have a challenging new project to tell you about. It's with Bright Road Healthcare Systems. They're considering implementing a new electronic health record system.
New? Are they currently keeping paper-based patient records?
Well, they do have an electronic system in place. There's a terminal at all the nurses' stations, but they're looking at expanding it so there's a terminal in every patient room, or maybe even tablets that can be used whenever they're needed. And the new system would be centralized, so patient information will be accessible at all of their facilities.
So there are interactions about every 30 seconds to keep the student actively engaged. In the case of this particular interaction, the student could choose any of these three options and Tanya's answer will be the same. However, there are some decision tree type options later on where the student will be remediated and routed back if they answer incorrectly. So it's just a way to ensure that the student is being an active participant and staying attentive throughout the episode. So we'll say, will the current system expand to meet their needs?
That's where they need our help. The board of directors has asked us to work with Bright Road's corporate team to gather information and make a recommendation. I would like you to work on this. I think you're ready.
Great, I can do that.
All right, what's your plan?
I think to get started, I'll talk to the team.
That sounds like a great plan. I'll send over a list of contacts for you. Thanks for taking this on.
So back at the office, I've got a new email. The screen will flash indicating that the student should click here. And then this just runs down the cast of characters that we'll meet in this episode. And again, click. Sometimes there's a little bit of a lag as it loads. It's never more than a few seconds though. So thank you for being patient. So first, we're going to meet Bob Walker, the CIO. It's nice to meet you, Mr. Walker.
Please call me Bob. I was actually the one who suggested the change. Sure, we have systems in the nurses' centers, but I can't believe we're still writing patient information on paper charts. Then they still have to enter that data into the system, doubling the work. It's ridiculous. So I'm researching a couple of new systems that might work better for us. We call it PRS, short for the Patient Record System. It's been around for about 10 years, and it worked great when we were small. But it doesn't meet our needs anymore. So our staff has a lot of workarounds.
We also have this navigation bar here at the top. You can pause, you can go back to a previous scene, you can fast forward to the next scene, replay a current scene. We can toggle on closed captioning just in case there's some issues with audio. And we can also go to this menu bar where we can see all of the episodes. And there will be a nice little green check mark here if that episode has been completed. But if we want to jump from episode to episode, that's certainly something that we can do, or download the transcripts. But for the interest of time, we'll skip ahead. This will also give you a little sneak peek at what the rest of the scenes look like and the cast of characters that the student will meet. But I want to bring us to the end analysis because I think that's most interesting. All right, so once we've met everyone, we've talked it all through, we meet with Tanya again to sort through and analyze all of the information.
So how do you feel after all of your interviews?
Feeling a little overwhelmed.
Maybe I can help you sort through it all. First of all, do you think a new EHR system is necessary?
I would say the CAO thinks we're moving too fast.
Okay, but I asked what you thought. It's time for you to evaluate what you've heard and make a call on it.
So you'll see how the student is being remediated and given feedback along the way to make sure that their thinking is on the right track for their end analysis.
Okay, good. Now, which system do you think will pose the least problems on the physical and security side? Okay, what about overall benefit to patients? Which system would be better for this?
Before we can answer, there's an incoming email. It's from the CIO, Rob Walker. So we'll read that. Say, excuse me, Tanya. We'll read through the email. Click. And this new information actually helps our decision a great deal.
Not a problem. So, do you agree with them?
Say yes.
Do you think cutting edge is the safest way to go when it comes to patient information security? Well, I think you're really close, and I'm sure you'll be able to come up with the right recommendation for the board. Remember, as a consultant, your advice is only as good as the information you receive from your team members. I think you've done a great job of collecting all the right information.
Thanks, Tanya. So at the end of each episode, there's a multiple choice assessment with 10 questions, which we'll report to the Navigate 2 gradebook. I'll click through quickly to just show you what that looks like. Fortunately, I'm not doing very well. So the student can take this quiz as many times as they'd like. Each time their score will be overwritten. So this is more so intended to be a practice or completion exercise versus an actual graded assessment. Once the student has completed the quiz to their satisfaction, they can export it to a PDF or just continue on to the recommendation, save the results and continue to the recommendation. Okay. So it's time to write our recommendation. This is the chance for the student to really implement their critical thinking skills and analyze and condense all of the information they've learned across the course of the episode. So once they type out whatever they're going to write and they hit send, congratulations, your recommendation has been sent. Then we can view and save the results, which will then export to a PDF, which can then be emailed to the instructor for grading or uploaded to Navigate 2 for grading. And it will show which scenes have been completed. It will show the assessment results, and then the recommendation will appear down here. And I think that about covers it. So I'm going to hand it back over to Suzanne.
Thank you, Danielle. Now I'm going to give you a bit more information about the products available, the features, and other resources that go with the Navigate 2 scenarios. There are 8 products in the Navigate 2 scenario series: healthcare delivery, healthcare finance, healthcare ethics, healthcare law, healthcare marketing, healthcare human resources, health policy, organizational and organizational behavior. Each of these products offers content aligned with our best-selling textbook, divided into 4 episodes. Within each episode, students take on the role of a CEO, marketing consultant, quality improvement director, health policy intern, and many other roles where they're faced with challenging situations and tough decision-making. Additionally, I'd like to point out some noteworthy features. The product is created using HTML5, which minimizes some issues with Flash. It's also ADA compliant, and as you saw from Danielle's demo, it offers built-in assessments that reports to our Navigate 2 gradebook, which is available available with many Jones and Bartlett Learning products. It's also affordable. If you want to use it standalone, it's $49.95, but when bundled with any Jones and Bartlett Learning textbook, that price drops to $15. So the students would pay for the cost of the book plus $15 for the Navigate To scenario. The instructor's guides are available for all scenarios except for the organizational behavior one, and include a storyline summary, which overviews the scenario, setting the stage, so to speak, a detailed character list that explains who each character is and what their role is, episode overviews, which put each scenario into context, learning outcomes addressed, which tell what learning outcomes are addressed in each episode, and finally, answers to the assessment quizzes. Finally, in addition, we can map the Navigate To scenarios to major related Jones and Bartlett Learning titles upon request. So questions. So far we have one, and I think I just answered it. Someone asked, can we use particular scenarios for courses in which we are not using your tests? Cost to us, question mark, cost to student. So like I said, you can use it standalone for $49.95 so that you could use it if you're using competing text or your own materials. So that would be the cost. And if you were using a Jones and Bartlett book, it would be the cost of the book plus additional $15. Any other questions?
There are some more questions coming through.
Okay. Okay, next question is there only one situation per topic or multiple topics within a subject area?
I think they're saying the episodes, it's like 4 episodes per scenario.
Right.
So we just saw 1 episode.
Right. Yes, we just saw one episode with which Danielle just showed to us. For each product, there are 4 episodes which present different issues that the student in their role in that particular scenario has to, think about and make decisions about. Sure. Do you want to read them?
Sure. Yep. So we have a few more questions here. Let's see. Are the scenarios time limited? And they are not time limited, no. For the instructors, how do we access these?
So there's an access code that you would redeem through your My Account page on jblearning.com.
Well, and then you can also, if you talk to your account manager, you can get a demo course ID, and that would be the first step in the process.
Right.
And then after that, instructors do have free access. How long is the series? I'm not sure if you mean in terms of total minutes, but Danielle, roughly how long is each video series?
I would say in terms of time to complete, it would take a student under an hour, maybe 45 minutes per episode, but that will vary from student to student. And then, as we said before, there are 4 episodes per each Navigate scenario.
Okay, does this integrate with Canvas, or does this integrate with Canvas or any LMS?
It can, I believe. It's just a little trickier, and you would have to coordinate that with your account manager. So I would encourage reaching out to your account manager to figure out how you do that, but it's possible.
And at the end of this, I will have a link to your account manager if you would like to talk to somebody in further detail or see a more in-depth demo.
Okay, do we have the ability to test the software? And yes, again, you would want to reach out to your account manager and they can get you access to the demo course, and yes, you can test it as much as you'd like. Can this be loaded into Blackboard? So similar to your question before, yes, this can be integrated with Blackboard, but again, you need to reach out to your account manager to get specifics. Is one required to use the textbook associated with the scenario? And the answer to that is no. You can absolutely buy this as a standard, or your students, you can require it as a standalone product, and then your students would purchase just the product alone. They'd get an access code and they could redeem it on our website, or you can bundle it with any Jones & Bartlett text. So including if you're using the McCarthy Healthcare Delivery for Pharmacists, again, you would just need to speak to your account manager and they can set up a bundle for you so that your students would be purchasing the text with the access code bundled in for just an additional $15. How do the cases relate to the content of the text? Danielle, would you like to speak to that?
So technically they're book agnostic, but
the content maps to the course.
right, and we can do individual competency mappings if that's something that you're interested in. If you have specific course objectives, that's definitely something that we can help with.
Okay. There's another question here. Does it matter which text or any as long as it's Jones & Bartlett? And that's right. It doesn't matter. You can bundle it with any Jones & Bartlett text. Again, just $15 over and above. We would just need to set up the special bundle ISBN for your bookstore to order. Let's see. We have a comment from someone who's been using the older versions, which is great. These are very similar. As Suzanne mentioned, they've been upgraded. They now use HTML5. They no longer require Flash. So much of this is going to be the same. It's just upgraded versions. Here's another question. Is that $49.95 per student? And yes, that is if you are adopting the scenario as a standalone product, then yes, your students would pay $49.95 to purchase the access code card. Can you pick and choose a particular episode to use? Do you know the answer to that, Danielle?
I'm not sure.
Yeah, I think we'd have to look into that. I don't believe you can break things up within the scenario and just pick and choose individual episodes, but we can certainly look into that.
Mm-hmm.
And we have your name. We can get back to you with an answer to that. Are there fees associated with the faculty staff My Account login? And no, there are no fees for that. You can create an account at jdlearning.com. There's absolutely no cost to that. And likewise, for faculty and staff, the product is, to demo it, to use it, it's always free for the instructor. Just scrolling down here, we have a few more questions. Is this suitable in an online class and Blackboard LMS? And I would say absolutely. Yeah, this is perfectly suited, whether it's online or on ground. This works great. Have the modules been updated since they were first rolled out as LearnScapes? And yes, as we mentioned, the technology has been upgraded. Also, the healthcare delivery scenario product was completely reshot. So it's the same storyline, but it's the filming of the product has been updated. Are more subject areas being developed than the ones you listed? That's a great question, and actually we are looking for feedback on that. We would like to develop out additional subject areas. So if you have ideas or requests for further topic areas, please let us know what they are. Can you please repeat the 4 Navigate scenarios? And maybe, Suzanne, if you want to show that slide where you have the 8 different Navigate scenario courses. There's actually 8 of them.
Right, there are 8 Navigate scenarios. There are 4 episodes within each scenario. So what we went through, that was 1 episode. So for the healthcare delivery scenario, there would be 3 additional episodes on top of the one that we looked at.
That slide. Yep. Yeah. So this slide shows each of the 8 different topic areas. And in fact, if you go to, we have a website set up just for the Navigate Scenario series. It's navigatescenario.com. And that shows each of the 8 different topic areas. But as you can see, within each area, there are 4 different episodes. So healthcare delivery, healthcare finance, health policy, healthcare law, healthcare ethics, healthcare human resources, healthcare marketing, and organizational behavior.
And also in your handouts attached in this webinar, in the right-hand panel, there's a tab for handouts. There is a full flyer on all of the different Navigate 2 scenarios and give you a little bit more about the, again, list these episodes and give you more information about system requirements and other information about the product.
We have another question here about pricing. Does $49.95 get you access to all of the scenarios in each of the areas? And no, it's just $49.95 per product. So $49.90, as you see the 8 different products here, it'd be $4.95, not $49.95 each. But again, that comes down to just $15 when you're using it in conjunction with a Jones and Bartlett Learning textbook. Let's see. Are there scenarios from the clinicians or direct service perspective versus management marketing perspective?
Not yet. These are from a health administration perspective. But if there's some scenario that you're particularly interested in seeing, we'd love to hear that feedback.
Were these primarily developed for use at the graduate level? They're looking for strategic planning, a strategic planning scenario series, okay. So we have some feedback here that one person is looking for a topic scenario on strategic planning. That's something we can certainly look into. And then the other question about whether these are developed primarily for use at the graduate level. Danielle, I don't know if you want to answer that one.
I think they can be used in the undergraduate level. As you saw through the one that we went through, it does kind of, walk you through. And I could see it being used either way. It depends on the needs of your course.
Okay, let's see. Can one receive the $15 cost if students purchase the electronic version of the textbook? I think we have a slightly different pricing model for that.
We do. I can't remember it off the top of my head.
Let us get back to you on that. I believe it's just a slightly different cost if it's in conjunction with the ebook, but we can find out for you.
Yes, we'll get back to you on that.
Okay, is there an instructor's manual?
Yes, as I mentioned earlier, there is an instructor's manual which, as just by way of review, includes storyline summaries, a detailed character list, episode overviews, learning outcomes addressed, and answers to all of the assessment quizzes. So each of them, with the exception of organizational behavior, comes with an instructor's guide. All
right, I think we may have answered all the questions at this point. But certainly if you have further questions, don't hesitate to reach out. Suzanne, I think you have one more slide with...
Yes, so for more information, you can download the attached flyer. You can request a demo or learn more at navigate2scenario.com. And also you can contact your account rep here at Jones and Bartlett Learning. And if you click on the link or write down that link, you can see which one is yours for your school and state. So all of that information is right there. And thank you for participating. We really appreciate your time today and hope you enjoyed the presentation. As I mentioned previously, the recorded version of this webinar will be sent to all those registered for the webinar by early next week. And finally, as you see at the bottom, we encourage you to join our LinkedIn faculty group to converse and learn from one another about topics and issues on the forefront of public health. This ends today's webinar, and thank you and have a great day.
So you can actually just close.